Okay, welcome everybody to join this webinar. I think if you join this webinar means already someone with cancer or someone wants to know about end-stage cancer reversal and also to understand the very successful medication called the P4 blocker. Basically, today's session probably about 60 minutes or so. We go through some slides and then your purpose is to gain knowledge, and after that you will maybe write down the question and you want to ask question, that's okay. And then you can contact to our team, and then we can actually send you more information and detailed explanation and instruction, and also under medical supervision that you can jumpstart this P4 blocker basically for any stages of cancer and tumor. Because after the 2020, 2021 pandemic, this COVID-19, after that with multiple injuries and also injection, infection, so many people is rising with the turbo cancer. And we have found out that a lot of cancer patients who has been healed before, and now they are having fast relapse and quick relapse. And the relapse comeback is actually quite dangerous and also fast growing. So people are looking for solution to actually kill off the cancer and also recover from cancer. So today is the discussion. Okay, and we have series of webinar for you to go through, and also we have done some other webinar as well. And if you want more information, you should go through more training. The most important thing is to gain knowledge into the brain and to be able to understand the next planning for the next 5 years, 10 years, 15 to 20 years, what to do to help your body to recover, okay? So we are from American Healthcare Team, and today's topic is on the Miracle P4 blocker for end-stage cancers. This is our team. Actually, our team will be able to help you to answer some of your questions, and you can reach out to us. At the end of the slide, we will be able to give you the contact, and you can actually get in touch with us. So we briefly go through what is the tumor and cancers. Okay, this is quoted from National Institute of Health. Cancer is a disease where some of the body cells grow uncontrollably and spread to other part of the body. So number one is the cancer cells growing in numbers, okay? And the second thing, it is invasion, invade to nearby areas, spread to other area of the body. And then it will also tell the blood vessel to grow, to supply them with the blood, supply them with the water nutrients, they steal the electricity, they steal the water, they grow new blood vessels, and then they are able to hide away from the immune system. Okay, this is what we call the immune evasion. For example, the police come to your house to catch the bad guy, but then the bad guy is telling the police that, I am the citizen, I have the IC, I have photostated IC, and I'm part of you, don't kill me, I'm your baby, kind of thing, So this is the trick of cancers. And then cancers actually grow in the absence of signal, sometimes no signal telling them to grow, they are still growing as well. So this is rapid cell proliferation. And then cancer rely on different kind of nutrients than normal cell, because usually normal cells take all the kind of nutrients from the daily living. But the cancer cell and cancer stem cell, they have a very special energy metabolism. They are able to take the sugar, ferment them, and then without the oxygen, they don't need oxygen to survive, kind of thing, but they hate oxygen. But if you give them oxygen, the cancer cell can die, kind of thing, But overall, cancer is increasing in number, and it is invading and spreading to the body. And then the third is relapses. It's always coming back. That's a big problem. So what is the hallmark of cancer? Actually, this is, in 2011. Now today is the 2025, right? So it's about what, 14 years, 15 years ago. This is a study launch. Okay, the hallmark of cancer comprises 6 biological capability. Okay, the 6 characteristics, and then they add on 2 more, 8 more characteristics, So total 8. So the progress in the last decade has added 2 emerging hallmarks. Basically, this hallmark, and in addition to cancer cell, tumor exhibit another dimension of complexity. Basically, cancer is a complex problem. They contain a repertoire of recruited offensively normal cells. So that, you see, this is very important. Every tumor has recruited ostensibly normal cells. Okay, in my previous seminar, we talked about 80-20 rules. Every tumor that you can detect, 80% is normal cell and 20% is bad cells, So it's very true, okay? That would contribute to the acquisition of the hallmark traits by creating the tumor microenvironment. This is what we call the TMN, okay? The tumor microenvironment means every tumor and cancers, 80% good cells and then 20% of bad cells, okay? The good cells actually, it seems like trying to kill them, but no, the good cells actually helping them. So what we need to do is convert the good cell to keep growing into good, and then, go and kill the bad cell. That's very important, okay? So this is a hallmark, basically sustaining proliferative signaling. That means they can sustain growing, and then they cannot be suppressed by growth suppression, and then this activating the invasion. They can eat around, spread around, invade, and they can spread, metastasis spread. And they can actually replicate the immortality. Wow, You know what's immortality means? They are not dying, or they are like some superhero that cannot die, Superman, they cannot die. Then inducing angiogenesis, wow, they can actually, this cancer, they can grow blood vessels, new vessels. And then they are resisting to dying, they are resisting cell death. They cannot die, basically. Wow. So it's like a monster, basically. So hallmark of all the cancers are rapid cell proliferation, tissue invasion, angiogenesis, immune evasion, suppressions. Okay, they cannot be suppressed, basically. And then differing energy metabolism so that they survive in the harsh situations. Wow, almost difficult to kill, impossible to kill. But no, we can actually chop them off. Stem cell driven process. We all need to understand whether today you are a patient, or maybe you're a family, or maybe a family doctor to certain patient. Maybe you're a doctor wanting to learn about integrative oncology, or maybe you're already a doctor that is practicing and you want to know more about it. No problem. We can actually empower you to understand even more. But cancer is actually driven by the cancer stem cell. Very important. So now all these features need to be present all together. Now, and they are active in one tumor. If you remove any one of these, you will actually block the cancer growth. Actually, any one of these, if you can block them. But if you can block more, it's okay. If you can cancel more, it's okay. But if you block one out of all these things, it would actually shrink the tumor. So this is the images talking about a prostate cancer cell. Is very unique. They are embryonic. They are very big, and they are very embryonic. They are very primitive, and then they keep growing. Basically, cancer is like a baby growing, like a pregnancy. They're trying to replace you. It's a SOL. It's a space occupying lesion that's trying to replace you. Okay. So now, what happened during the embryo implantation? Today's topic is about talking about every human cancers. They behave like a pregnancy. Okay, and they're protected by placenta. Okay, and if you chop them off, you cut the placenta, the cancer cannot grow, but to regress and shrink. Okay, that's a good news. Okay, today you need to know that. So what happened during the embryo implantation? Okay, for example, day 6, the egg and ovum, the human, the sperm and the ovum, the egg, they meet together and then they fertilize and then they form the morula and blastocyst. Day 6, 7, 8, 9, it is implantation. So the placentation and implantation, very important process, basically. So when they implant already, then these cells here, it's called the cytotrophoblast and syncytiotrophoblast. Basically, this trophoblast is behaving exactly like cancer. They go invade into the human and try to steal nutrients and then try to establish a new life form kind of thing, So, okay, during the human embryo implantation, pregnancy happens, conception, they call it the product of conception. During a pregnant mother uterus, what happened? Same thing, rapid cell proliferation, tissue invasion, angiogenesis, immune evasion, immune suppression, different energy metabolism to normal cells. Okay, they are using anaerobic glycolysis. That means glycolysis means stealing the glucose, ferment them, and aerobic means with oxygen. Can you imagine? Fermentation usually happen without oxygen, you see, but they are able to ferment sugar under oxygen. Wow, this is actually an embryonic nature. Okay, and then they can lyse away glutaminolysis. Glutaminolysis means the cancer cell and also pregnancy is able to steal the mother or the host glutamine. They steal the glutamine. Glutamine is from protein, basically. That's why you see the cancer patient, wow, they're very thin, the breakdown of the muscle, they lost the muscle, wow. So basically, it is like a monster consuming you inside out, you see. How do you kill this monster? And then this process is driven by trophoblast and stem cell. So I compare these two slides with you. Okay, this slide is the feature of all the cancers. Okay, this slide is the feature of all the placenta. So it's exactly the same. It's called identity. It's not even similar, okay? It is identical. Now, is this something new? No, it is proven one, okay? It is proven and also scientifically already explained and also discussed and also discovered. Okay, how does placenta function in pregnancy? Okay, what is the unit of placenta? This is a baby, and then this is the placenta. If the placenta not doing well, they will be leaking and bleeding. So the placenta must be very well connected to the uterus. You can see my laser pointer here, the placenta. Okay, if there's any trauma, they'll be bleeding, the separation, they call it the decidua. The separation from the decidua or the mother, So if there's any trauma, if let's say, for example, some people violently kick the mother tummy during the pregnancy, oh man, that's a trouble and trauma, then there will be bleeding, separation of placenta. Wow, if you attack the placenta of a pregnant woman, then the baby have to come out. The baby will die. Okay, so what does placenta do? Placenta is stealing the blood. I don't want to use the word steal, but let's use this word called divert. Divert, yielding, and channeling. So in a normal human pregnancy, the baby placenta is to channel, yield, and divert the blood to the baby. Prioritize, the host or the mom feel very tired. Why? Because oxygen is being diverted. You know, between the baby and mom, of course, the baby get the oxygen first. No? So sometimes the mom tired, you know, and then they'll be able to steal or divert, yield or channel the nutrition to the baby. So that's why holds the weight loss. For example, cancer or pregnant woman, if pregnant mommy not eating well, sure, they will lose weight and they will become malnourished. Yeah. And then protection from rejection. Yes. You see, you need to understand more than 50% of a baby, the antigen, the gestational antigen means when you're pregnant with a woman pregnant with a baby, the baby gestationally inside the womb, 50% of the antigen is from the father. Yes, of course, because XY and YY XX, a woman is XX, right? And then the man is XY, right? So half of the gene from father, half of the gene from the mother. So by right, every baby inside the mother is 50% very antigenic. By right, the mother should reject this baby. But how come this baby is able to stay inside there for 10 months? So this is the blocking maternal NK cell hostility. This is very important. The placenta summary is to channel and divert and yield blood, oxygen, nutrition, and also provide the protection from rejection, at least for 10 months. Okay, that's the placenta function in pregnancy, which the placenta function exactly behave like cancers. So if we can chop the placenta, we can chop the cancer away. All right. So 50% of gestational antigen is from father and husband. So, but cancer antigen also can be identified and we can expose it to the host. And then the host can be induced into a cancer rejection immunity. Okay. Now look, how does cancer look exactly like pregnancy? Actually read here. Cancer is a pregnancy of multiple monsters. Okay. For example, human pregnancy is singleton, means one baby lah, you know, or twin means two baby. You know, sometimes 3, 4, 5, those are, you know, IVF lah. But then you see nowadays, okay, usually human pregnancy is 10 months, 40 weeks, then you deliver. Can you imagine this baby, 20 months also never come out, maybe 12 months, 11 months, 12, 13, 14, 15, 16 months, sure the mother will die, or the baby will die. Okay, the baby have to come out. Now, go to the right side here. You can see cancer is a monster pregnancy means, imagine now if you have cancer, it is like 10 to 20 to 50 monster pregnancy at one go. It's growing fast. Okay, and then it's metastasized, spreading around, invasion, go move here, move there, move around. And then more than 10 years of gestation. They stay inside there 10 years. Can you imagine you're pregnant with 10 baby to 20 baby and they plan to be there for 10 years? That's the problem. So they always relapse, you see. So all human cancer, they behave like a placenta and they have progesterone function because placenta life and also maturity of placenta totally dependent on progestin and progesterone. So progesterone is a very important hormone, to maintain the pregnancy because of the placenta health is maintained by the progesterone. So the progestin, if we can find a cutter and swallow the tablet every day, one tablet, 90 to 180 days, all the cancer cell placenta can be chopped off. This is a great news. Okay, by understanding cancer is exactly like a pregnancy placenta function. So chopping off the placenta is wonderful. Okay, how do we know? How do we know cancer is like a placenta? Okay, the placenta is like a cancer, and the way to reject the placenta is to actually increase the NK cell to kill the placenta. How do we know? So scientifically, a lot of doctors and also scientists, researchers, we go and look for spontaneous abortion. For example, some people, 10 months old pregnancy, some of the mother is not able to hold the pregnancy. Sometimes the baby miss abortion, come out, less than 10 months, sometimes maybe 1 month, 2 months, 3 months, 4 months, oh, the baby didn't survive and come out. And then the discharge of all these tissue have to come out. When this tissue come out already, we check and see what happened is inside this spontaneous abortion. We can see a lot of maternal NK cell is inside this tissue. So whether the baby is normal or abnormal chromosome, okay, the NK cell appear to display deleterious effect on fetal development, resulting in spontaneous abortion in mice and human. Okay, the infiltration of NK cell into the decidua is associated with spontaneous abortion. Okay, so whether it's habitual or not. So therefore, placenta will protect the baby 10 months growth. That's very important because the placenta will avoid, will try to protect the baby, but from the mother's NK cell. Okay, because every abortion, missed abortion or unsuccessful pregnancy, the tissue here, all the tissue is full of mother NK cell. Okay, so what we are going to discuss today is how do you induce your whole body NK cell to kill the cancer? Just to let your NK cell to go inside the placenta, which is protecting the cancer. Okay, because cancer have a placenta. All right, so placenta protects baby 10 months growth, and then placenta actually is trying to separate the mother NK cell from attacking the baby. Okay, this same mechanism is being stolen by cancer. Every human cancer ever discovered by human has placenta, and they have progesterone and progestin influence. So if you cut off the progesterone and progestin, you would be able to chop off the placenta supply to and protection to the cancer. And then finally, your own NK cell, the human NK cell, is able to go into the cancer and kill them and clear them and expel them like an abortion. Okay, so the conclusion is simple. We wanted to induce a lifelong cancer rejection immunity that lasts a lifelong time. So we want to train you how you can stimulate your immunity to kill the cancer cell once and for all, and your NK cell is able to go into the cancer and reject them and abortion, like an abortion, basically. Yeah? So what is the evidence of similarity in growth and invasion and angiogenesis and immune evasion? These are the few studies that I want to go through with you. Simple. The cancer and pregnancy, they are parallel. They are identical. How do you know? This is in 2009. These studies by Holton. Okay, this study talk about the immune tolerance mechanism that support normal human pregnancy are also exploited by malignancy, which is cancer, establish a nutrient supply and immune evasion. And then actually the placenta will edit the human immune response. Basically make a confusion, your whole body policeman cannot go and catch the cancer. Even they catch the cancer, they cannot kill because the cancer tell them, look, I'm your baby, I'm part of you, let me go, I want to grow and I will come back, I will grow and replace you, So basically this is a study, okay? And then it is a very interesting study because they have done the receptor study of placenta. Okay, these are all the placenta receptor ever discovered. Okay, and then they compare with tumor. They found out that tumor behave exactly like a placenta. All the receptor looks the same exactly. It's not even similar. It's identical, basically. So then this slide is inside the study. The study talk about, wow, in the past history, 10, 20, 30, 40, 100 years, all the doctors and also scientists, they go and discover a lot of blocker, a lot of tablet, a lot of these, advanced rocket science medicine, okay, just to go and block the cancer. For example, they try to block the growth signal, try to induce apoptosis, medicine to stop the replication, anti-angiogenesis, many medicine to stop the tissue invasion, and try to do immunotherapy. But then we need to understand, we cannot fail to understand that cancer and the placenta, they are actually the same, and then they behave like a trophoblastic cells, and then the pathway is controlled by a lot of gene, okay? All right? And then the chances of cancer due to random DNA mutation. Many people think, oh, the cancer becomes smarter and mutate. Actually wrong. A lot of people think, oh, my cancer becomes smarter after first round of chemo or surgery or radiation. Usually we cut ourselves, big hole, put into the bag. We have a urine bag and then the colon bag. After that, we have all these things already. We go through, oh, my cancer becomes smarter. No, actually the body become weaker. The body become dumber because our immune system became less sensitive, So a lot of people think, oh, cancer is due to random mutation. No, actually like a lottery basically, which is similar to odds to getting struck by a lightning 17 times in a year. So actually, the point is, the chances of you having a random mutation and causing you having a cancer, right, is totally very rare. Basically, cancer is predictable, and also controllable, and then they behave like a new life. It's a life. Basically, it's not a pregnancy, okay? It's not a product of POC, product of conception. No, this is a product of cancer, product of monster. Imagine the monster, 10, 20 monster growing more than 10 years. So then if we go back to the embryology revision, we will be able to understand the placenta is very important to hold the host health and also the baby. For example, the mother health and also the baby during the 10 months, the placenta is very important. Okay, one very common disease called the preeclampsia means high blood pressure. And the high blood pressure happens in the mother when the placenta is not properly developed or there's a defective in placentation here, defective placentation, okay? And then trophoblastic damage, okay, you can have hypertension, means blood flow increase. Okay, that's good news. Imagine if you take the tablet, placenta blocker every day, wow, you disturb the placenta supply to the cancer, and then the cancer will increase in blood flow. Blood pressure increase to the blood cancer. Good or not? I think good, because if you have cancer, the blood flow increase, then it will increase drug delivery, vitamin delivery, nutrition delivery, even heat delivery, hypothermia. Wonderful. It's gonna help the cancer to grow, to heal, and then it will stop the cancer to grow. because cancer cell usually is very traffic jam, and then their blood flow is not good. But if you disturb the placenta supply to the cancers, actually you can improve blood flow. Okay, so the placenta is a highly metabolically active organ, fulfilling the bioenergetic and biosynthetic. They are supposed to provide energy. They are supposed to provide production of nutrients to support the rapid growth of the baby. Okay, with the placenta in cancer, oh man, shit, it is growing the cancer. So, and then it provide kilo, 2.5 kilo ATP means energy. Placenta give you energy. Okay, glucose is a major nutrient source for the placenta, which is true. Cancer cell eat the glucose like crazy, So cancer cell also eat away your glutamine, take away your fatty acid, and then they, they actually change the host. They are able, cancer and baby, they are able to take alternative fuel source. Okay, even though the mother is not eating, fasting, and all this thing, the baby will not be sacrificed. God is fair, making the baby last longer than the human host. That's how a generation of life gets go on. But then cancer cells stealing this mechanism of lasting longer and turn into immortal. So long-held view of lactate as a metabolic waste product has been revised. Okay, you see, placenta, one of the job is to increase lactate. Why? Because once you take the glucose, you ferment, you become lactate. Lactate means acidic. Cancer cell acidic is because they like it to be acidic so that they can keep growing. And then placenta, when they are acidic, they are more efficient. Okay, so that's why if you chop out the placenta supply to the cancer, you can actually reverse the acidity. We always say cancer patients are DTA. D is deficiency. Okay, T is toxicity. Because you are deficient, your body gets smaller, then you have a lot of toxin, increasing DTA, toxicity. The third phase is acidity or DTA, acidity. The acidity comes from the lactic acid. So imagine if you take placenta blocker every day, 1 tablet a day, wonderful. You can actually chop off and your body become not so acidic, it's wonderful. So 30% of glucose from the maternal circulation is converted to lactate by the placenta, even with oxygen condition. This is what we call the aerobic glycolysis, Warburg effect. The Warburg effect means there is fermentation in the phase of oxygen present. Usually when we are not having enough oxygen after exercise, then we have anaerobic glycolysis, but this glycolysis is aerobic. That means this lactate is abnormal. Okay, usually lactate is normal when you exercise. When you exercise a lot, then your body transiently not enough of oxygen and sugar, then your body will go into lactation. This is what we call the acidity a little bit, But then cancer cells constant producing acidity. They like acidity is because they can continue to grow. Okay, this is the growing mechanism. So if you chop it off, you will not be so acidic. Okay, this is wonderful. The production of lactate uncouple glycolysis and TCA cycles so that they can occur independently. That means many cancer cells, just like a baby, they can keep on growing even the mom is not growing. They can keep on eating and breeding even the mom is sleeping and starving. So that is the priority. Okay, that's placenta, very powerful, strong. So imagine placenta trying to protect the cancers. So biosynthetic process in the placenta. Placenta not just by giving the energy, but also trying to synthesize. That means generation and make nucleotide, fatty acid, cholesterol, amino acid to grow the organism. And then glycolysis is actually building blocks, making building blocks, okay? And then trying to pentose phosphate pathway is actually to give nucleotide. Basically, nucleotide is the DNA material for the new cells to come out. They have this protein glycosylation, and then placenta is supposed to make nucleotide, make protein, make triglyceride, make fat, okay, make purine and glutathione. Basically, is to grow the monster. I mean, the placenta, if a normal one, will grow the baby. Okay, but the placenta, abnormal one, will grow the monster of the cancer. Okay, they are exactly the same, basically. Okay, so lactic acid actually is a signaling molecule in pregnancy. Okay, in pregnancy, sometimes the pregnancy, we want to monitor the pregnancy, whether it's normal or not, we check the lactic acid, right? But cancer, like the tumor, the blastocyst, placenta, trophoblast, can also produce a large number of acid, okay, during the early pregnancy, especially lactic acid, okay, modulation of the immune system. Okay, why cancer cells and also baby, they want to have lactic acid and acidic? Because they want to train the mommy and also the host immune cell not to attack them. Okay, the lactic acid is to protect the cancer cell or the baby from the attack of NK cell by the mommy or the host. So can you imagine this is a very smart mechanism? They're trying to produce lactic acid. Lactic acid released in the unique uterine environment could have similar effects on the trophoblastic cell and immune cell during the early pregnancy. That means lactic acid is bad news. Okay, so how do you know lactic acid is high? You can test the blood called the LDH, you check regularly your LDH level cannot be too high. If LDH level too high, you're actually, drowning in your cancer growth kind of thing, okay? So lactic acid is a very bad NK cell suppressor, basically. Just now I told you, right? You saw the missed abortion, right? The missed abortion, the baby come out from the human less than 10 months one, every tissue of those baby, they do a biopsy, they check, wow, it's full of mommy NK cell. So basically, the simplest way forward to kill cancer cell and reject and abort the cancer cell is by introducing a lot of NK cell and allow the NK cell to invade into the cancer cells and get rid of them. So conclusion is NK cell from human is able to do complete cancer abortion in a human if you know how to signal and help and chop off the placenta supply. So lactate production by the mammalian blastocysts manipulating the microenvironment for uterine implantation and invasion. So lactate create a microenvironment of low pH around the embryo, assists the uterine tissue to facilitate trophoblastic invasion. You know what does that mean? When cancer is acidic, more invasion is easily happening, more metastasis. So acidity surrounding a cancer is very bad because it will promote the metastasis, it will promote the invasion, it will promote the relapses. So therefore, chopping off this thing is very important. So finally, it suggested that the region of high lactate low pH created by the blastocysts modulate the activity of local immune response. See, the cancer cell is very smart. They want a lot of lactic acid. When the cancer or the baby is acidic, well, guess what? They can evade mommy NK cell. That means the NK cell cannot come and attack them and kacau them. So this is a smart mechanism that we can chop them off, okay? Now, this diagram talk about placenta here, trying to steal all the nutrients from the mother to go to the baby. So if you change this diagram into cancer, it's the same thing. This is the host, protein, all the food, the muscles, all the goodies, the iron, the blood is being stolen by the placenta to feed the cancer cells. So if you chop off the placenta, and then the cancer cell can die off and get out of the body of the mom, and then the host can actually survive and also thrive. Okay, what is the evidence of similarity in immune evasions? There are many other studies. I'll quickly go through it with you. These are the studies. Okay, this is actually 2020, 2019. Okay, the transient immune suppression can happen in the 10 months. Tumor can exhibit pattern of immune suppression very similar to those observed during fetal development. So basically, this is old school. It's not new thing. Cancer and pregnancy is exactly the same. Okay, this is not new. This is old school. Okay. So during the pregnancy, what is the immune changes is Th1. Changes from Th1 to Th2. Th2 is immune tolerance. Th1 is rejection. That means if you have very bad illegal immigrant in your country, you will be Th1 trying to kill them off and get them off. Th2 means MM2H, welcome, everybody stay in my country, kind of thing. So this is actually the immune tolerance. So during the pregnancy, there's a transient from immune attack into immune tolerance, which we don't want, like cancers, basically. Okay, regulatory Treg is very high, okay, during the pregnancy. And then PD-L1, this PD-L1 is actually the blocker, blocking the NK cell from killing the foreign and non-foreign, basically self. Basically, cancer is like a self, S-E-L-F. They're trying to tell you, I'm your baby, don't kill me. But then we don't want that. We want the host to be trained to understand how to reject the cancer. Okay, they found out that galectin-9 was significantly increased in pregnant women. Unlike the cancer, the level of PD-1 dropped within 6 weeks postpartum. What does that mean? That means initially the 10 months, there is immune tolerance. Okay, after the baby being delivered out of the mommy body, you know what happened? All the immune tolerance will drop. But cancer cannot. Cancer persists because cancer never deliver. Cancer is a 10 to 20 pregnancy one shot. They plan to stay there not 10 months, but 10 years. So when they stay there for 10 years, the immune suppression is always there. We need to chop them off, basically. The placenta blocker can work on all these receptors here. Okay, the placenta blocker, first generation is called mifepristone, basically. Progesterone receptor antagonist cross the blood-brain barrier, very powerful for glioblastoma multiforme. This is a very amazing old school. I think doctors and also scientists already known this 100 years ago. Okay, 80 years ago, rampantly using in multi-center. 40 years ago in research and also trial and also launch worldwide. But then multiple registration also passed through because this is such a good thing. It's for very nasty brain cancer, grade 4. This is launched in this study is 2014. Treatment will allow operation with end-stage pancreatic cancer in hospice. on a morphine drip, to restore a decent quality of life. This one is in 20, berapa? This one is 2020, okay, 5 years ago. Okay, then long-term high-quality survival with single agent before treatment despite advanced lung cancer. This is advanced lung cancer, advanced kidney cell carcinoma. This is a 2-case report in 2016. High long-term quality survival. Okay, refractory ovarian cancer. The ovarian cancer that's refractory means resistant to treatment, also successful. This is very powerful. In year 2000, this year 2000, that's 24 years ago. So it's not new, okay? This is a very exciting discovery. It's not discovery, basically re-receipt. Okay, so the review will summarize the parallel proliferation, invasion, immune privilege. Okay, I want to stress this important to you. Pregnancy is an immune privilege. Okay, because pregnant is a life and then supposed to have 10 months privilege. Okay, they are free to grow. They are free to keep on invading the mummy. But this is 10 months. All right. But cancer, no. Cancer is long-term immune privilege, long-term growing, long-term invasion, long-term relapses coming back, right? So by understanding perfectly pregnancy mechanism, we can actually exactly cure cancers, basically. Okay. We do not want tolerogenic system. Did you see it? It is described the similarity between tolerogenic system within the tumor microenvironment. Basically, this study talk about comparing the tumor microenvironment and the fetal maternal interface, which is the placenta. So basically, placenta equals to cancer cell development. Okay. So now another study talk about trophoblast. The trophoblast, which is the placenta, pseudo-tumorogenesis. They say, how come this placenta, it looks exactly like cancer cells, They have done many studies like this, and all the scientists, they look into the placenta trophoblast. Hey, it behaves like cancers, they grow and grow and grow. This is shocking to them, but actually this is no big deal because this is God's mechanism. This is in the 2004, which is 21 years ago, yeah? Okay. So by understanding placenta behavior and chop off the placenta, we are able to provide a lot of cure for the cancer patients, and also especially after the pandemic, after the pandemic, a lot of all these turbo cancer, we would be able to combine. Basically, the first item to take is every day 1 tablet before 6 to 9 o'clock in the morning. You pray. After that, you swallow this tablet. You chop off the placenta. No placenta supply to cancers. The cancer stop growing. Yeah, imagine the cancer is like a Ferrari running at 200. How can you go into reverse gear? Cannot, right? So if you swallow this placenta placenta blocker tablet, progesterone blocker tablet, P4 blocker tablet, every day 1 tablet, immediately your leg is pulling off from the accelerator. The Ferrari running at 200, 300, right? Then you lift off your leg from the accelerator, then the car slows down. All right, and then you press on the pedal brake. Okay, then the car slow down to 0. When the car is 0, then you go into reverse gear, then you can actually, reverse the whole cancers, right? So this study talk about trophoblast research over the past decade has underlining the striking similarity between proliferative, migratory, invasive property of placenta cell and those of cancers. All right. So among the autocrine and paracrine loops that might be involved in the strong proliferative capacity of proliferate cancer cells, and all these EGF, EGFR, okay, even the tumor associated antigen looks the same. Okay. Now, if you're a cancer patient, okay, if you have tumor, you check your biopsy. Many cancer biopsy have EGF, EGF receptor, HGF receptor, PI3K, AKT positive, MMP9 positive. All these positive are good news for you. Okay, this cancer, your cancer, most likely, as a matter of fact, all cancers are responsive to placenta blocker, basically. Okay, so this is a study that I can send to you. This is a very important discovery study. Okay, this is a case study, basically. Okay, so this abstract is very powerful. And then I think by the time you join this meeting, our team has already sent this document to you. Okay, this document very important. I think a few pages, maybe 10 pages like that. I want you to print out, you read already, you will be able to find your case inside there. And I want you to share with your family member or even the doctor that treat you. You can pass it to them and ask them questions, no problem. And then let your doctor know that, all those are integrative doctor. Maybe you're seeing an oncologist, or maybe you're sick and tired of the hospital. You are already not responsive to conventional treatment, or you're a hospice patient waiting to die, or maybe you have no more option for you. Don't worry. You read this and then let them read also, let whoever read also, very important. So basically, there's a good evidence that cancerous tumor borrow some of the same mechanism as the fetus to escape immune surveillance, including the PIBF protein. PIBF protein means placenta-induced blocking factor. Basically, this blocking factor is actually an NK cell blocker. It blocks the mummy or the host NK cell to kill them. Basically, don't kill me, I'm your baby kind of thing. So this blocking factor can be chopped off. Okay, so cancer cell do the same. Okay, and then you see, indeed, there is a good evidence that mifepristone, this means a first generation. This is a first generation. This is a placenta blocker. For your information, there is a third generation, there is a fifth generation, there is a seventh generation also. All right. So this is the first generation. A drug approved for pregnancy termination can significantly improve length and quality of life in patients with various advanced cancers. Okay. So okay, you can see here. And then there is evidence that P4BF is one of the most important immunomodulatory factor produced during pregnancy to inhibit immune rejection of the fetal semi-allograft. Okay, that means cancer also the same. Cancer is using an immune rejection of the NK cell. Okay, cancer is inhibiting the host immune rejection. So if you chop them off, that means your NK cell can be faster and work faster. Okay, one mechanism by which P4BF can suppress NK cell cytolytic NK activity is by inhibiting degranulation of perforin granules. Okay, what does this mean? This means the P4BF is actually a fake ID. Basically, the cancer cell inside there's a fake ID saying that I am you, I am your baby, don't kill me. Every time the cancer cell come to the, every time the NK cell, natural killer cell, the mummy, the host come to the cancer and touch on the cancer cell will tell the NK, don't kill me. Okay, so, and then it is inhibiting the NK cell. So the P blocking factor can be blocked off. Okay, so cancer might borrow some of the mechanism to escape the immune surveillance. Okay, so the blockade of immune function of cellular immune cells in the tumor microenvironment. Okay, so over the years, other benefit of mifepristone related to its anti-progesterone effect has been redeveloped. Okay, including treating uterine leiomyomata. Okay, what is this? This is uterine fibroid. Basically, this drug is not new kids on the block. It's an old drug, basically. Okay, more than 100 years. All right, and this drug medicine is approved around the world. Okay, only specialist doctors is able to prescribe it. Okay, and then it is used to treat uterine fibroid. Okay, very successful. But they used 300 milligram for Cushing syndrome also. But in the clinical trial and also this treatment, you only need 200 milligram, which is 1 tablet a day, things like that. Okay, and absolutely amazing for leukemia. Read here, you see, okay. To do so, we collaborated with Dr. From the Roswell Park Cancer Institute. Many years studies protein production by leukemia cells line. 29 cell line of diverse lineage were all found to express messenger RNA for P4BF. Wow. That means almost all the human cancer ever known to human is having the P4BF, this blocking factor, means NK cell blocker. Basically, it's sensitive to progestin and progesterone. So this blocker can be completely chopped off. Okay. Now, these studies, you can see majority of the P4BF blocker is inside the cancer cell. Okay, that is good news. That means if you take this placenta blocker, it is going to affect only the cancer cell because this blocking factor is only inside the cancer cell. Okay, normal cell, they do not have these blocking factors. Okay, basically this is wonderful because unless you're pregnant, you're not pregnant, right? If you're not pregnant, then if you have cancers, that means you have multiple monster pregnancy, right? And then the blocking factor is inside the cancer cell. Okay, so it's intracellular. Some people say, oh, my cancer is not progesterone sensitive, like breast cancer. Breast cancer, estrogen positive, progesterone positive, HER2 positive. Okay, triple negative means estrogen negative, progesterone negative, HER2 negative, right? Some people say, oh, my tumor biopsy is not positive for progesterone, so this won't work. No, actually, you don't need to be positive for progesterone receptor and the biopsy because this blocking factor is inside the cancer cells. And then look at here, the glioblastoma multiforme, very responsive. Okay, see okay, here is talk about leukemia cell line studies. Adding P to the media upregulate this. P4BF protein to the media found that P4BF increase the number of cancer cells day 4 and day 5 treatment. That means if you give progesterone to cancer patient, wow, usually the cancer can grow, So cancer patients shouldn't be, taking a lot of hormone pills, estrogen, progesterone, hormone replacement. Okay lah, if you're confirmed with cancer, don't do that lah. Especially don't supply yourself with progesterone because progesterone will grow further the placenta supply to the cancers. Okay, so that's very important. P4BF promote proliferation of human glioblastoma cancer cells, independent of an intact immune system. Wow, even though your immune system is normal, if you chop off the PIBF of the cancer of the GBM, wow, the brain tumor shrink, is very important. Okay, so then you can read through this. I can send this data to you. This is actually, let's go through the let's go through this. Yeah, look at here. They in 2010 means 14 years ago. The thesis was PIBF, the double-edged sword, pregnancy and tumor. That means PIBF is present in pregnancy and tumor. Pregnancy, we desire it for 10 months. Okay? So if you have 10 months of immune suppression, let the baby grow, okay lah, can forgive you lah. But then in tumor, no. 10 years, 10 to 20 monster growing, the PIBF can be chopped off. Okay? Now, okay. 15 years later, the concept we published in 2001. Basically, the author of this study, they have been talking about this 20, 30, 40 years ago. In 2001 starting, okay, it has been widely accepted that the placenta blocker is wonderful treatment to be add on as a first-line treatment for many, many crazy cancers. That's very important. And it's prostate carcinoma. Oh, wonderful. Because all the prostate cancer, they have progesterone receptor. Progesterone receptor will grow placenta for the cancer. So if you block the progesterone in prostate cancer, good news for men lah, because prostate, progesterone in men, very little usage, basically, especially when you're older, 50, 60, 80 years old. When you have prostate cancer, you don't need so much of progesterone, chop it off lah, basically, by taking the tablet, okay? Basically, and prostate cancer is absolutely responsive to this placenta blocker. Basically, one tablet a day, 6 o'clock morning to 9 o'clock morning, in between there, usually before 9 o'clock every day for 90 days to 180 days, wonderful. Okay, even PR negative, you can still use it. Okay, testicular cancer, testicular cancer very difficult to cure, very, very aggressive, very difficult to treat, lymphocytic leukemia, for your information, no lymphoma and leukemia cases is without the progesterone one. Every leukemia and lymphoma is sensitive to progesterone cutting. It's very important. So basically, when they take 200 milligrams per day in human with progesterone who had no sick day, basically there's no sick day. All right, that means taking already no side effect, and also tumor stop growing. Patients start getting well. So the benefit of mifepristone is not merely for cancer positive for the classic nuclear PR. If the mechanism of improvement did operate through the PIBM mechanism, the presence of classic nuclear PR positive is not needed for production of PIBF expression by the tumor cells. Yeah. Okay, why this is important? Because if you are a cancer patient, you want to take this placenta blocker, then there will be a lot of doctors saying that, hey, you know what? Your cancer is not positive for progesterone, so don't take this. That's a wrong thing, okay? That's a wrong advice, because clearly the study talk about intratumoral. That's why this whole thing is called intratumoral placenta blocking. Very important, intracellular production of PIBF, okay? Okay, case report. Let's go to a case report. Okay, now, based on cell line study, control animal study, we wanted to determine if the progesterone, this mifepristone provide increased longevity and improved quality of life. So then this was not related to risk of the drug. But they, unfortunately, a lot of doctors say this is very risky. But this drug has been approved and is safe. Okay, we are just using it off-label. Okay, and there was a restriction for usage of this mifepristone or the derivative lah, basically. Okay, this was not related to the risk of the drug, but related to appeasing groups that is rejecting this because they say this is abortion medication. No, basically this is just a chop off of the placenta. Okay, and then they think they want us to go through the investigational new drug approval. Well, this is oxymoron. Basically, this is an old drug. Why are we investigating a new drug in an old drug that is already approved? Basically, it's called the off-label use. We just need to understand that we are using this off-label. Okay. Now, I want to quickly go through with you case one. Case one is 46 years old woman. Thymus epithelial cell cancer. He started to take one tablet a day. He was offered. There was no standard chemotherapy. He approved for experimental expertise, and then the cancer still progressed. And then after starting the tablet, okay, the cancer regressed. The lung and mediastinal lesion did not regress, but they remained stable, feeling much better. The clinical improvement persisted over 2 years. Can you imagine this case? 2 years survival. Okay. And then her oncologist then later, after 2 years, said that, hey, the lesion stable. Hey, why don't we do a cure? let's do a second dose of radiotherapy to the mediastinum. Okay, this patient after 2 years, okay, the doctor say go and do another radiation go. She went for radiation, then died from the fibrosis. So it's sad, basically. If you take this tablet for 2 years, you survive. Maybe you need to take for another 20 years, it's okay, correct? Why you want to attempt new stunt? So basically, it's very effective. Even palliative or quality of life, or it sustain your life, basically. Maybe you still have tumor, but then you survive. Why don't you continue it, Why you want to try any other very deadly, harsh treatment, So the first case of our series of anecdotal case treated with mifepristone started treatment in 2004. It is important to note that thyroid epithelial cell cancer is not known to be associated with the classical nuclear P receptor. This is a case where there is no classic progesterone receptor on the tumor, yet the patient still get well. So I want to tell you that even though basically I just want to tell you, you don't need a biopsy lah. If you have a biopsy, then it's okay lah. You don't really need a biopsy to prove that the cancer will be responsive to this treatment called the placenta blocker treatment. Basically, placenta blocker treatment is very general. It just cut off the placenta supply to the cancer cell baby, cancer monster. Case number 2, 61-year-old woman, 6.5 cm invasive, moderately differentiated adenocarcinoma of the transverse colon. It's a colon cancer spread to liver, peritoneum, ovary and uterus everywhere. Basically, long zhong kena, the whole tummy long zhong kena. Also ascites of tummy got water. Largest liver metastasis. Wow, the liver got 2 tumors some more, no? 3.1, 2.3 cm. Okay, she was advised by the oncologist that even with chemo, auntie, this 61-year-old woman, auntie, you will die. Only 15% chance of living 6 months. Wow, the hospital already already give you that sentence. Okay, what happened? After 1 year of mifepristone therapy, 1 tablet per day, the CEA antigen dropped all the way down to 1.6. 1 year or 12 months, This patient didn't die 6 months, but last for 1 year. After 18 months, there have not been any growth or metastatic lesion, no new growth. She had no pain, no vomiting. She was saying that the energy was very good. Can you imagine? And then CT scan, 22 months, some growth of the lesion. She was pain-free, good energy, even at 27 months. The oncologist says 6 months. The oncologist, all the hospital doctor, the expert, they try to say this, that, they act God. This one cannot last for 6 months. Who say? This patient last for 30 months. Look at that, 30 months, And then 30 months, she died. Okay, why she died? Several years later, talking to her sister, found out that 18 months, to save money, she started to take the mifepristone every other day. Oh, shit. That means 1 day take, 1 day skip. That's the reason, died. So 18 months, still, every other day from 18 months can last until 30 months. Can you imagine? So this is wonderful. This case helped to establish that the daily dosage should not be less than 200 mg per day. You should take 200 mg or more. The case also support the concept that mifepristone can prolong life and provide palliation. It's the best palliation, basically. So every other day cannot. Basically, I wrote here. So if you want this proofread study, I can send to you because I read this. I highlight. And I can send it to you if you want to read. Very interesting. In case number 3, 43 years old, stage 4 metastatic colon cancer. Metastatic means spread everywhere. 43 years old, waiting to die. After 18 months of treatment, the metastatic lesion began to grow. 18 months. Basically end-stage cancer patient last for 18 months, then only progression of disease. Okay, she assumed that this was the end of the remission. So she stopped. She stopped and she tried a new experimental drug. Then she died 3 months later. So please, non-stop taking this. Very important. If you have no option, if you are joining this webinar, you're someone that is really end of the road. You see 4 or 5 doctors, they all shake their hands off and say, you go home and die, GHAD, go home and die, wait for your 6 months kind of thing. Just take this tablet. What the hell? Take this tablet every day, But you can combine this together with the rest of the treatment, no problem, the integration. Okay, case number 4. 83 years old man, stage 4 colon cancer, spread to the lung, liver, peritoneum, lymph node, no improvement. Capecitabine, tak boleh. Cannot. Cetuximab also cannot. She was so weak that she could not get out of bed. Within 2 weeks of this tablet, obtained with compassionate use. Or you have to apply compassionate use. Because you're dying already, dying already, you can try anything, right? So you just write there compassionate use, so you get this tablet, take lah. So this uncle take already, what happened? Within 2 weeks of this tablet, energy return, no? She was able to resume normal function and go to restaurant. No? He can go to restaurant, and then the cancer scoring down to 0. Social event also, no? I bet he go to dance or maybe go and joget or maybe disco, I don't know. His appetite also return, no? And he was pain-free. Can you imagine pain-free? Hello? 83 years old man with cancer everywhere, whole body pain-free, you know? Okay, see, after 4.5 months of treatment, none of his previously rapid growing metastatic lesion grew, with the exception of one lung cancer lesion grow 0.3 cm. You know, the whole body got tumor. 4.5 months taking the tablet, no growth, no new growth, no progression, only one small piece. He had no side effects from treatment. Why? Man, as I told you, man, good news for you. If any man here, if you join this meeting and all these things, you understand this. If you're a man with a cancer, no problem. Take this tablet because progesterone in men very little usage. You just block and no side effect one. Okay? He had no kidney metastasis, but he pre-existingly had marked renal impairment. He became uremic after the treatment. The wife was deciding dialysis when he died of a sudden myocardial infarction. So at the end, this old man did not die of the cancer. He died of a heart attack, I think because of the kidney failure. The kidney failure was happening before the cancers. Okay, case number 5, let's see. Sometimes instead of mifepristone therapy causing stable disease, changing pattern from rapidly progressing to slow progression. Yeah, good news. Case number 5 means if you have a cancer that is fast growing, you can slow it down with this placenta blocker. Okay, some of the lesion may show marked regression, you know. So, okay, what's the attitude of taking this placenta blocker? First, I want to stop the cancer growing. That's my first attitude. Second, I hope they are not rapidly growing. They must slow down. Attitude number 1 is slow them down. Okay, attitude number 2 is stop them growing. Okay, attitude number 3, maybe you pray. I think I want them to shrink. And how do you shrink the tumor when it's not stop growing? You can do low dose radiation, you can do intratumoral injection, you can do hyperthermia, you can do IV vitamin C, you can do IV artesunate, selenium, curcumin, you can do quercetin drip, you can do ozone, you can do intratumoral manipulation, tumor treatment, you can apply all these imiquimod to the breast tumor, you can do so many things, heat up the tumor, no problem. Okay, you can combine it. Okay, so it's very important. Okay, 45 years old woman, widely metastatic leiomyosarcoma. This is a kind of sarcoma of the uterus. Sarcoma are very aggressive. 45-year-old woman. Okay, despite previous treatment with total hysterectomy, cut off they chop it off, take out everything. They take out the ovaries, and then put on letrozole. Basically, letrozole is a estrogen blocker. Many women cancers they forgotten to block progesterone. No. They like the estrogen blocker, breast cancer. They like the tamoxifen, eat the whole life, letrozole, eat the whole life, hormone treatment. Wow, so many eating. But they forgotten to block the progesterone. Actually, progesterone blocking is very important for women. Basically, I want to tell you the placenta blocker, no side effect for postmenopausal women or elderly women more than 45 years old. Usually, you don't have much side effect. Okay, if you're less than 45 years old, young woman, maybe progesterone is a little bit useful for you. But then when you have so advanced, big cancers, blocking it off is very important. Okay, now you see this 45-year-old woman resistant to gemcitabine, docetaxel, which is chemo. Resection of lung. They cut the lung away also, still growing the cancer. Then start the tablet every day. Okay. Then after start the tablet, cause an almost total remission. Disappearance of almost all lesions. Those remaining had shown marked decrease in size. All the cancer reduced in size. 6 months later, okay, some cancer begin to appear, but they were still very small. Okay, let's discuss how come this person after taking this tablet, tumor shrink, 6 months later increase growing. Maybe he's happy this woman never kim chui, eat a lot of things, take 7 mouthful of rice, 4 pieces of meat, 1 vegetable, wrong food, never change the diet, never do detox, never do so many other repentance. We have to diet is very important. Detox, coffee enema, water enema, ozone enema, rectal ozone, home program, subcutaneous injection, immune stimulant, IV drip, all these are important hypothermia planning, fever, it's very important, So integration treatment should be carry on. You cannot just try not to just depend on this one thing, but change your lifestyle, sleep well, eat well, juicing, blender, take your pill box, do your RGCC test. This is important. See? So now 6 months, some lesion begin to appear but they're still very small. The oncologist opted to stop this tablet And then the oncologist see her already, put her on the experimental trial. Okay, she died within 1 month from the complication of this new drug. Okay, ladies and gentlemen, please, if you join this meeting, I want you to read this case 5. Okay, WTF, you know. WTF. Okay, what the fish? Basically, come on, man. If you're taking this very successfully, continue this tablet. Don't go for experimental stunt, you know, all these rocket science, you know, all this is gonna. Actually, the real killer here is the person who give the wrong advice, basically, please. Actually, this is not new drug, basically, this is just something that is fantastically working, even multiple resistant cases. Okay, case number 6, CLL, chronic lymphocytic leukemia. Wow, 80-year-old woman, CLL. Okay, chest X-ray, many lung lesion, probable advanced lung cancer, multiple metastatic lesion. See, and then clinical diagnosis, small cell lung cancer with the syndrome of SIADH somehow, no? And then the bleak prognosis. Actually, the doctor already said bleak prognosis even with chemotherapy. Same another case, go home and die Okay, GHAD go home and die, kind of thing, Okay, then she said, okay, I want to try this placenta blocker. 1 month, oxygen returned to 99 to 100, no? Without the oxygen, she doesn't need oxygen supply anymore. She doesn't need to use the oxygen machine. 1 month, And then the serum sodium increased back to normal. CT scan show complete disappearance of all the lung lesion, Even 5 years after initial diagnosis, 5 years later, completely healed. She did remain, however, a ground glass appearance in the lung a little bit. Okay, she died 5.5 years later at the age of 85, from heart attack, not from lung cancer. I tell you, 80 years old, another 5 years of quality life, important, Okay, this woman's CLL show progress while her rapidly growing presumed small cell lung cancer had a complete remission. Okay, this 80 years old case, is 2 cancer in one, very rare, This 80 years old lady got CLL, chronic lymphocytic leukemia. On top of that, got a small cell lung cancer. The small cell lung cancer, very rapid one, very deadly one, very aggressive one. Therefore, the conclusion is, the more aggressive and more rapid your cancer cell is, the better the result it would be. Wow. Okay, it is possible for these neurons to help keep the CLL slow growing, but it could simply be related to the normal situation of slow growth progression. That means they argue this, they want to recognize this placenta blocker very effective against rapid growing aggressive cancer cells. So what are the top 5 very difficult to treat cancer now? Okay, pancreatic cancer. Number 2, melanoma. Number 3, small cell lung cancer. Wow, very fast die one. Number 4, TNBC, triple negative breast cancer. Number 5, leukemia, lymphoma. Maybe number 6 is the GBM, brain GBM, glioblastoma multiforme. Wow, this one deadly one. The more deadlier, the better you can use this. Okay, now here, read here. Many cancer therapy are ineffective for brain metastasis or primary brain cancer because this therapy cannot cross the blood-brain barrier. Okay, there is anecdotal evidence that mifepristone can cross the blood-brain barrier. This placenta blocker, even the first mifepristone is first generation. We'll discuss the 3rd, 5th, and 6th, 7th generation later. So it crossed the blood-brain barrier, provide palliative benefit, primary brain cancer and brain metastasis. Wow, wonderful. Okay, case 7, you see, 43-year-old man with the GBM. This one is a brain cancer. You see, these are glioblastoma multiforme grade 4. Wow, grade 4 means stage 4. Grade 4 means very aggressive. Okay, absolutely very fast growing, aggressive, gila, crazy brain cancer. Glioblastoma multiforme. Okay, temporal lobe means on the side. But also in the frontal, parietal, temporal, the whole brain got even spread to spinal cord already. 43 years old man dying. Okay, despite the surgery, radio, chemo, the tumor rapidly progressed. He was not considered a candidate for any other therapy. Okay, at the time of starting this treatment, he was paralyzed from the neck down, and his hand were fixed in the clenched position. Wow, the hand clenched, cannot move. He slept most of the day, and when awake, was not able to carry out conversation, cannot talk to you. Within 2 weeks of this tablet, he became much more alert. 2 weeks, able to carry out intelligent conversation. He can talk to you, He was now able to open his clenched fist and move his hand. He continued treatment for 3 months and remained alert, 3 months, However, his paralysis slowly progressed to the point he was having trouble breathing, swallowing, Then the ubat stopped, then he died. But this is dramatic. So I want you to know that even you take the tablet, the tumor shrink already, you need to work on further shrinking the tumor. How? You can do intratumoral injection of the plant extract, even chemo, go buy a little bit, inject, we can do it for you also. You can do hyperthermia, heat up the tumor, you can do Colis vaccine to have fever, low dose radiation, we can arrange for you to go for low dose radiation to further shrink the tumor, not high dose, low dose. So you should do more things to continue your journey. Don't just do one thing, do a few more things together. Case number 8, you see, 68 years old man, stage 4 non-small cell lung carcinoma, spread to the brain. Okay, refer by the oncologist for the placenta blocker. Even the oncologist say, oh yeah, sorry cannot no, nothing to help you. You go you go and see this doctor and take the placenta blocker. Wow, wonderful. Okay. Based on the experimental data with efficacy on this placenta blocker, okay, FDA already approved, you see, it says, okay, for the benefit in individual cases with various advanced cancer following single agent therapy, the placenta blocker therapy, the FDA approved imitated study. Okay, this basically this tablet can be taken under clinical trial. Okay, fine. And then treatment with oral as a salvage treatment in patients who have failed one or two or more previous chemotherapy. You have to fail 2, no? You have to fail 2 or 3 more chemotherapy, baru you can join. So bad, So good news for you in Malaysia or in Southeast Asia, we can use this as a first-line treatment now. Okay, so you can give our staff a contact, send us your report. If you're interested in this medication, it's very simple. Send us all your report, and then we do a one-on-one, free consultation. We just consult and let us see your situation and help you to plan out. Okay. Okay, look at this case. 68 years old male. No tumor marker that could provide him targeted therapy. Yeah, because there is no, the least option you have, the more better news it is. Although this look like a bad news, no treatment for you. So his cancer progressed despite 3 rounds of multi-agent chemo, including carboplatin, docetaxel, pemetrexed, gemcitabine. They tried all this drug chemo. So in October 2015, he had a seizure some more. And then cancer in the brain progressed. Then receive palliative radiotherapy to the brain. So even getting worse, you see, dyspnea, difficult in breathing, very tired. Okay, PD-1, PD-L1 also negative, not a candidate for immunotherapy. Basically, this is a very bad case, 68 years old, heart-based one, dying one. Okay, so what happened? In all previous case, the tablet obtained and the costing is about $500 US dollar per month. No in Malaysia is 950, 900, less than 1,000 ringgit. This is even expensive overseas. In Australia, I heard one tablet $300-400. Crazy. Okay. Then so we decided, this author, the author decided to start this case. This case start to take this tablet. After taking this tablet, actually, because the tablet is supplied in 300 milligrams, usually 200 will do. Okay. Oh, his clinical symptom improved within 1 month of treatment, no? Okay. And then he remained cancer score 0 after 4.8 years. 4.5 years, no? He didn't die. Okay. And then there was no evidence of growth of his previous brain metastasis or any new lesion. That means it's a complete response, He's responding to it. And then his quality of life is there. And then this is an end-stage dying case. 5 years of still not dying. Okay, so this is important. So it's oncology based on this experience under anti-cancer. Okay. The patient feeling so good on this therapy and feeling so poorly on all his previous chemotherapy regimen. So he opted to take our advice and continue on the placenta blocker therapy. Now, 3.5 years later, still feeling great. He is very satisfied with his decision not to stop this treatment. So it's a smart idea, right? Correct. So I wanted to tell you, many patients, they don't have good experience with all the hospital treatment ever happened to them. Like the harsh treatment, like for example, surgery, cut a big hole, you chop your left breast, then your right breast chop off, chop your body off. It's a very disfigurement treatment experience. Once you come out, you lost one arm, lost this, lost that. Maybe you lost your colon and then you have a shit bag, the colon bag or urine bag. Then you go through all these hair-dropping chemotherapy. So harsh, compared to all those harsh treatment, this one is actually quality of life and also give you good result, pain-free, appetite come back. Why? Because placenta steal your blood, oxygen, nutrients, steal it away. So immediately you chop it out, the cancer cell choke off. Basically, it's choking the cancer cell to dying. So if the monster is not draining your energy, draining your oxygen, draining your blood, you won't be anemic, draining your protein, you won't be losing weight, draining your sleep habit, draining your immunity, you feel well. Okay, so, okay. But it makes no sense to try a completely new experimental drug with unknown side effect. Yeah. Many cancer patients, they make this mistake. When they go into remission, they treat themselves nicely already. They itchy bum, they go and try new things. They go and try to look for new doctor, try new experimental thing, and then then die. Then they try the new thing, then, it bring more harm than good. Okay? So if you stop the treatment, sometimes it will have rapid recurrence. Why? Because you did not clear it. Basically, when you take the placenta blocker, the cancer cell baby, the monster growing in your body, is chopped off the supply. But if you don't expel them, they are still there. It's like a frozen thing. So my suggestion is that after you take this already, rapidly try to also detox and also expel this cancer out. Very important. Okay. Now, therapy with this placenta blocker will be considered a hormonal therapy. But because it's hypothesized mechanism that you remove a block, yes, listen, the mechanism is that the placenta blocker will remove a blocking factor. This is a NK cell blocking factor. So it allows the human host cellular immune system, especially the NK cell, to attack cancer cell. This is the main mode of action. So it is also could be considered a form of immunotherapy. This is the reason why we discuss this today, because in our center, we do immunotherapy. We train the human host to see the cancer properly, and then we try to let them learn how to cure the cancer once and for all. So the question arises as to whether the drug will be effective in cancer positive for the programmed cell death, PD-1, PD-L1, blah, blah, blah. The answer is actually the placenta chopping mechanism of every cancer cell do not need scientific approval. Basically, cancer behave like a placenta. Okay, so you don't need rocket science or biopsy expensive things to prove that your body will work. You just give it a try. Okay, it will work. Okay. So it is suitable for all type of resistant and stubborn cancer. This is, after I read it, I put down my thoughts. This is Dr. Kenny thoughts. Okay, my point. Okay, case number 9, you see, case number 9, 66 years old, stage 4 non-small cell lung cancer. And then the biopsy is EGFR positive one. Any one of you have this lung cancer like this, PD-L1 positive, who not only had a PD-L1 positive, PD-L1 marker positive, also EGFR positive. Wow, fantastic. Very good for the placenta blocker. So you see, so this lady, 66 years old with lung cancer, of course, they do the chemo, carboplatin, all these things, but still, the cancer progressed. Okay. She started on targeted therapy, this, that, blah, 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 erlotinib. This is very famous. They do a biopsy on your lung, then EGFR positive, they start your erlotinib, Tagrisol. The medicine name is called Tagrisol, this kind of tinib, So at that time, there was only first generation tyrosine kinase inhibitor, basically. Okay, see here, the cancer progressed despite taking and treated with 11 cycles of the checkpoint inhibitor nivolumab. He was stopped after 11 months because the drug no longer inhibiting the cancer progression. Basically, there's no disease-free progress. This is progression already. So then she qualified for this study. So what happened? After 18 months of oral tablet, there have been no cancer progression. For the first time in her life, this 66 years old woman with cancer struggling, treat, the cancer growing until the tablet started 18 months, no growth. Everything else failed, but this tablet helped her to have zero growth of cancer. Then this patient every 2 months CT scan. So 18 months, every 2 months means 9 times, 9 times of CT scan show also no cancer growth. As a matter of fact, some lesions are actually smaller. Can you imagine? If you chop off the placenta supply to the cancer cell. Wonderful, no? She was considered ECOG 1. ECOG basically is a cancer scoring. The higher the score, the worse your lifestyle will be. Okay, cancer score 1. And then at the end of 1 year, she still is 1, scoring 1, good quality of life, normal physical activity, 66 years old, end stage lung cancer, normal physical activity. So after 1 year, her COPD increased. Okay, she needs some oxygen. But her chronic obstructive pulmonary disease grow. Maybe she's a smoker. I don't know. But cancer still has not progressed. Powerful. Okay, 18 months. Okay, she died 2 months later from pneumonia. She did not die from cancer, but died from pneumonia. So, okay, ladies and gentlemen, if you're PD-L1 positive lung cancer, EGFR positive, okay, you can swallow this tablet, okay? So, all right. Okay, the FDA also approved this for all these multi-failure. Even after many failure, you can try this tablet. See, this tablet is when all else fail, you start taking it. But I have patient ask me, hey, Dr. Kenny, why should I fail everything? Then only I start this tablet. Can I start right from the beginning? For sure, yes. Why not? You can start this one a day tablet, continue it. No problem. Okay, so this talk about investigation. Okay, perhaps some of the fault lies in making the criteria for registering too harsh. Basically, the entry criteria to taking this tablet being set too high. We should bring down the criteria. Basically, this tablet is available for anyone and everyone listening to this webinar. Okay, so okay, but most of the problem is that we have not been referred very many patients to even screen for the study. Okay, even the physician who referred to us, our first case, who is still doing so well after almost 5 years of single agent, the physician, plus with no side effect, they have not referred to us another patient. That means a lot of doctors, they don't want this to happen. This is bad news. I mean, this is a disruptor. Basically, the patient well already, then the hospital no business. The doctor also no need consult, no need to go back to them. They lost the patient, lost to follow up, no need to come back. Basically, no more clients. So, you see, we asked him if he had, this doctor have more patient to refer us. He stated he could send us 40 patients in a year, but patient do not want to travel 100 miles every month to receive the medicine. So then, basically the author is an O&G specialist, this doctor who published these studies, multiple case studies. He's the O&G obstetric and gynecologist, oncologist, basically a woman oncologist, the oncologist for women cancers. Okay. And he's very sad. He said that, he wrote here, you see, even our own well-renowned cancer center at our own institution turned down the opportunity to be a principal investigator of this useful medicine. Our own center has never referred one patient to treat this cancer. And they had lung cancer for these investigators, initiated study for compassionate use. Actually, this medicine is registered as a compassionate use, but now it is the first-line treatment for triple-negative breast cancer. For now, for what we have ascertained, they refer the patient to hospice when they are at the stage eligible for our study. Wow. What does that mean? This line itself saying that every patient that is currently in hospice, please, you are the patient totally suitable to swallow this tablet, because this tablet is absolutely palliative, going to give you good life. You can imagine you can go back to a social event, you can go to a restaurant, you have enough energy to move around, you live another 5 years, kind of thing, pain-free, you can sleep. It's wonderful, see, so yet this kind of evil doctor yet they kindly refer to us many patients to consider oocyte freezing or embryo banking before potential ovary damaging therapy. So he's laughing at his own colleague, saying that all these colleagues would rather go and take their oocyte and preserve all the sperm and ovum and then send the patient for high dose chemo damaging drug therapy, but they are not willing to take a look at this placenta blocker. But the placenta blocker is absolutely wonderful, basically. Okay, case 10 and 11. Yeah, I wrote here, these idiotic doctor, they would rather do more damages to kill their patient. WTF. Okay, that's my own feeling. I feel we as a doctor, we should let a lot of people know about this placenta blocker easily, okay? Now, actually, there were 2 patients with lung cancer that screened for this. Okay, this is 2020 case. You can read through. This is actually, okay, Okay, woman with stage 4 non-small cell lung cancer. Basically, it's non-small cell lung cancer are very effective, basically using this tablet. Okay. Okay, case 12. Case 12. Treatment with this oral blocker, pancreatic end-stage cancer. End-stage pancreatic cancer in hospice on morphine drip. Restore a decent quality of life. So demonstrated a marked relief of her severe pain that has been present despite opiates. That means despite giving you morphine, you still have pain. After taking this placenta blocker, okay, no pain. High quality of life. However, this patient, the husband is a doctor, was informed by a major oncological center of a new phase 1 research study. Jeng. The husband, Ichibam, quickly brought his wife there for treatment and she died 2 days later from cardiac complication of a new drug. Okay, so it's a stupid new drug by the big pharma that can kill many people, no? Okay, this is basically this placenta blocker is old news, old school, old drug, repurposed. Okay, anybody can start this. Okay, just sign a consent form saying that I volunteer, I want to take this. You can start taking this tablet, no problem. So do you know cancer patient? Okay, take a stone out and throw outside, it will land on someone with cancer or their family member. If they don't have, you ask, do you have cancer? You don't have, your family gone, sure have. So you can help them by letting them know the good news about this placenta blocker, yeah? Case 13, osteosarcoma, wow, bone cancer, okay? So the wide diversity of different advanced cancer that has responded to extremely well-tolerated oral mifepristone, frequently providing the patient with the best quality of life. The reason is that even in less advanced stages, many of these patients suffer from side effects of chemotherapy or even immunotherapy. A lot of people have side effects from the very harsh treatment. So that makes this tablet wonderful because of the safety profile and also side effect very, very unknown, very little basically. Pancreatic cancer and fibrous osteosarcoma are not known to be associated with the nuclear progesterone factor. That means even cancer that is progesterone negative, you can still take this placenta blocker, okay? Here, malignant fibrous histiocytoma, 23-year-old man, extremely aggressive transitional cell carcinoma. This one, bladder carcinoma, cancer of the urinary bladder and kidney. Also very successful using this tablet, okay? So, all right. The rest of the study you can go through. Okay. Now, listen to me. This is important. Okay, placenta blocker is a type 2 progesterone receptor blocker. It can promote DNA binding and also promote progesterone receptor phosphorylation. So the placenta blocker given to advanced stage tamoxifen resistant women, listen, a lot of women after the breast cancer removed, blah, 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 taking tamoxifen, right? After a while, tamoxifen also resistant. After a while, tamoxifen also useless. Wow, they give them this placenta blocker. And then there's a complete response and partial response in about 10%. But then you see here, 6 out of the 11 show stable disease, That means 6 out of 11 is more than maybe 60%, 70%, or around 60%. More than 60% of the patient will go into stable disease. Can you imagine, even you cannot cure yourself, this is making your cancer stable. It's absolutely very useful for you, okay? If you have any family member or you have cancers, wonderful. Okay, so you see, another small study found that objective response of 18% in untreated metastatic breast cancer. This is powerful. Okay, so okay, now for ovarian cancer, this medicine is given 20 years ago to patients with ovarian cancer and persistent lesion, recurrent lesion, despite 1 round of chemotherapy. My question is, 20 years ago, people start using, right? Why is it obsolete? So that's why I'm making this available. I'm making this accessible. I'm making all this information totally down to earth, easy to understand for anyone who have cancers and who's struggling with it, who wants to get well, who still have some relapses. I want to talk to those patient and family member with cancers that is living with the cancer, still people living with cancer in their body and living with it. So, all right. From what we know today, if they would have continued the drug, the ovarian cancer may have progressed slowly while the patient maintain a high quality extension of life. Wow. So you see, so you have to continue it despite all odds. Okay, as a doctor, we should do discussion. Don't deprive your patient. Okay, be sure that the tests are sensitive enough to you see, we do not think it would be unreasonable to see if a given specimen produces P4BF, but can we be sure that the tests are sensitive enough to deprive a patient the potential great benefit of the treatment with this placenta blocker? So please, doctors who wanted to stop your patient from taking this placenta blocker, no, please don't do that, because you might be counseling them wrongly. You know, this is a tablet to be taken firstly. You know, look, gynecological cancer, breast cancer, progesterone cancer, sure lah, ovarian cancer, okay, cervical cancer, sure, you can use woman cancer. Let's discuss woman cancer, cervical cancer, uterus cancer, ovarian cancer, you know, breast cancer, lung cancer, brain cancer, pancreatic, leukemia and lymphoma. Can you imagine? Sarcoma, can you imagine? Wow, this is absolutely a good news, you know. Okay, is it possible that a certain stage cancer can make progesterone like okay. Okay, this is all scientific lah. This portion here for doctors lah. Okay. Okay, now here, very well tolerated. Okay, look here. About 20% of meningioma are associated with classic P receptor positive. Meningioma. Meningioma means cancer of the brain and the spine, you know, spinal cord and the brain surface, the wrapper. Wow. You see, large study comparing this versus unresectable tumor did not find any therapeutic benefit for whether this could be because meningioma are slow-growing tumor. Okay. However, it's also possible that some meningioma are considered benign. One benefit of this large study was to demonstrate very good safety profile for methotrexate with a few side effects. Means this progesterone blocker is absolutely very safe, very well tolerated. Okay. But look, since a compassionate use, investigational new drug, actually very oxymoron. This is an old drug. Why they want to force us to say that this is a new drug and under investigation? You know, anything that cure is a bad news to the FDA and the drug company, you know. Man, you know, anything that is partially curing or keep you chronicity, oh, then they say this is a good drug. I think it's very bad lah. That organization is very evil and reluctant to grant an off-label use unless a standard treatment has been exhausted. This is very true. You know, if you're living outside Malaysia, right? If you're from the US, Australia, you know, UK, it's very tyrannical in Singapore, you know, you're supposed to deplete and exhaust all the standard bad treatment or not so good treatment or not so effective treatment, expensive treatment, so-called conventional drug treatment, hospital treatment. You have to exhaust it first. You have to fail multiple things first. Oh, then you are palliative already. Okay, then only you're allowed to use this new drug under investigation and under compassionate use. I mean, this is very evil. This is very wrong. I think the good news is that triple negative breast cancer, you know, triple negative breast cancer is so difficult to treat. No surgery and no chemo, no radiation is able to help basically. But it is considered the first line therapy right now using the placenta blocker for TNBC. So I want you to help me to reach out maximally to all the triple negative breast cancer patients. As a matter of fact, any breast cancer patients, tell them about placenta blocker. Tell them to join a webinar or somehow join our Zoom, or we can send information to them, basically. Okay. One exception is a man who at the age of 58 found to have bilateral renal cell carcinoma with metastasis to local lymph node. This is kidney cancer. Any one of you have kidney cancer here? Raise your hand. And then today, you know, you can see that is everything okay? Even okay? Yeah, okay, good. Okay. So bilateral renal cell carcinoma. It's very interesting. Please go through it with me. Look here. Renal cell carcinoma can be multifocal even when several lesions are present. The tumor is generally not aggressive, basically. Today the recommendation is renal sparing surgery and to remove the tumor every time one reaches a certain size. Okay, 16 years ago, the recommendation was bilateral nephrectomy. That means if you have a kidney cancer, they need to cut your whole kidney and throw away. But RCC very sensitive to placenta blocking, you know. Renal cell carcinoma extremely sensitive to progesterone cutter. Cool. Very important. Okay, since there were no chemotherapy or immunotherapy agents 16 years ago for renal cell carcinoma, so and the patient don't want to be a dialysis creeper, so FDA approved. FDA approved this drug to be used. Okay, see, this patient, 10 years of single agent treatment, no new tumor. But the impressive is this patient survived for 10 years, no die, 10 years didn't die. The 3 lesions previously noted on the left kidney remain stable. 10 years, the diabetes caused kidney failure and the start of dialysis. He had a 1.5 kidney removed. After 2 years of hemodialysis, he was approved for kidney transplant. He's still doing well 16 years from initial diagnosis. Wow, can you imagine? This is very extreme, Guys, ladies and gentlemen, this is 16 years of the patient taking this tablet, no die. I have written here, 16 years, no die. Okay. This case shows that the placenta blocker can work to inhibit tumor growth even when not at the rapidly growing cell stage. Okay. The earlier you start, the better it is. Okay. It's great to prevent relapses. Very important. The use of placenta blocker in early stage metastatic cancer following tumor remission, following treatment with chemotherapy or immunotherapy, to possibly inhibit recurrence. Very important. Let's say, for example, after you've gone through all the surgery, radio, chemotherapy, you are now in remission. Maybe you have a little bit of cancer, you are already cured. Or somehow the cancer, like a volcano, dead volcano, the volcano is still there, is not erupting. You can take this tablet to prevent the relapse. Basically, it's wonderful. Okay, very sad but true here. Let me read. Once a tumor has widely metastasized, chemotherapy or even immunotherapy may frequently extend life, somewhat at the expense of significant side effects from treatment. Very true, no? See, one final thought. Frequently, once a tumor had widely metastasized, chemotherapy or even immunotherapy may frequently extend your life, but no cure, somewhat at the expense of significant side effects, which is very true. I mean, you have no life already, okay? Cannot cure already. Still, you had to go through the treatment that is harsh. I mean, how can a treatment be harder and how can a treatment be worse than the disease itself? Sometimes you need to think. As a doctor also, we need to also realize that if you are an oncologist listening to this webinar, please wake up, And this item is medical item, basically. This is also, if you can use letrozole and tamoxifen, this item, you can use it also because this is actually hormonal therapy and also immunotherapy, basically. It's very important. And it works on cancer stem cell also. It is actually working on cancer stem cell because it is intratumoral placenta NK cell blocking factor blocker. It is chopping off the blocking factor inside the cancer stem cell, embryonic cancer stem cell. Very important. So placenta blocker is without major side effect. So will provide possibly a higher quality of life, than approved therapy. He argued and said that a lot of approved therapies out there, but they're very harsh. They have a lot of side effects, and it sucks. It doesn't work well. So these medicines should be approved better than the approved therapy because very safe. Almost no side effects. Sometimes skin rashes. I've been using it. Some patients sometimes got skin rashes because of the toxicity of the cancer cell dying, and then you have to detox them. Sometimes they tired some few days. Then after that, energy come back. Majority has reported better appetite, better energy. No more stolen energy, no more stolen anemia. No more stolen nutrients, no more losing muscle, kind of thing. She is wonderful. Pain relief, sleep, all good. So realistically, it is unlikely that the placenta blocker therapy will become popular in capitalistic society. So this is the conclusion. Very sad, because of our society being capitalism. We want to make money out of the sick one. So therefore, the more expensive rocket science standard therapy that is so expensive that is free and fully paid by insurance company, then is good treatment. Who say? So as a cancer patient, we have already getting so bad into this. So we wanted to make this available, basically. So it's very affordable. Okay. Now, yeah. Okay. Okay, why don't we do it as a first-line therapy, basically? Okay, here. Possibly the manufacturer may one day reduce the price considerably, or it will be manufactured by a generic company at a much lower price when the patent expired. Okay, I mean this drug, this placenta blocker, perhaps at a lower cost. Insurance company will be happy to pay for off-label use of this placenta blocker, realizing how much cheaper it is for cancer therapy than conventional chemo or immunotherapy regimen. Well, insurance company to cover this, I think it will never happen now. Very sad. Okay, because anything that cure is bad news. Okay, in medicine, Anything that's chronic, oh, good news. How to keep a patient sick and keep coming back to the hospital. I think this is a very evil thing. Oh, this will never happen. Yeah, for the sake of the quality of life, we should use this medicine. Basically, the author actually wished that many doctors like us is able to continue the treatment protocol for this item, make it available. Sometimes it can cause low potassium, so we need to supplement the potassium for these patients, okay? So, but then don't do high dose, 200 milligram per one tablet a day, very successful, very useful already. Okay, see, look here. Similarly, case number 9, who was taking the 300 milligram dosage, did develop hypokalemia, means low sodium when we switch to another drug. Okay, reverted back to normal when it stopped. So basically, if you experience any side effects, if you stop it 24 hours to 48 hours, everything is clear off. You know, your side effect can be off. So sometimes I advise patients 15-day rest 1 day if you really have a side effect. If not, then continue. If you tolerate, then every day take. Some people very severe reaction, maybe 10-day rest 1 day, 7-day rest 1 day. Some people 3-day rest 1 day, 3-day rest 1 day. But we don't need that. Usually very well tolerated. Okay. One man with stage 4 non-small cell lung cancer become more somnolent when adding this to the fentanyl he was using for pain. That means he can sleep better. We advise him to reduce the dosage of fentanyl. He chose to just stop the mifepristone. Then he died 2 weeks later. A lot of people, they stop this medicine, they die. Okay. So at the back here is the bibliography, multiple studies. Those of you who have different type of cancers, you can refer to this document. This document will tell you all kinds of, you will find your case here, basically this, you can find your case here, basically here, lung cancer, colon cancer, testicular cancer, prostate cancer, leukemia, even fail multiple treatment, no problem, brain cancer, pancreatic cancers, okay. Okay, so it is proven that in cancer, the blocking factor is entirely intracellular. Therefore, this anti-progestin will work for cancers more than on human. So if you tell me, if there's any tablet once a day you take that is going to kill the cancer and not killing the patient, this is it, basically. Okay, so this is the 3rd generation. They are the study that I posed to you all are mifepristone, the 1st generation. So there's 3rd generation. The latest one is 7th generation compound 17004. Okay, this is for stage 4 of all type of cancer, metastasis to bone, lung, liver, brain, lymphatic, swelling, ascites, pleural effusion. If you have stage 4, very serious one, you can start with 7th generation now, which can cross the blood-brain barrier, go to your bone, go to many areas. So this is based on clinical judgment and trial. You can get to sign up with us with a trial and all these things, or under clinical supervision, you can take this medicine. 5th generation is for stage 3 cancer, 2 organ involved, not more about more than 2 cm. If anything's 4, 5, 6 cm, big one, it's already 7th generation, 5th generation, 3rd generation. 3rd generation is stage 1 and 2 cancer, 1 or 2 organ, tumor less than 2 cm, around 950 ringgit for the studies group. There are 5th generation, 7th generations available upon recipient of your study. If you have cancers, okay, send us your report. Whatever report that is needed, send to us. So what are the integrative steps to add in besides the treatment? First of all, you chop out the placenta by blocker. Okay, you take the tablet every day. Second, you destroy further the cancer. How do you do that is you want to destroy the tumor material. You do a PET scan, show us where's the tumor. We try to do intratumoral injection, check your cancer stem cell, and then we continue to destroy the cancer further by hypothermia or low dose radiation, refer you to our panel for some low dose, not high dose, but low dose radiation therapy, 5-day rest 2 day, 3-day rest 1 day kind of thing, take it slowly and then further destroy the tumor. After that, you have to expel expulsion of dead cancer tissue, send them out of your body. Then repair and restore the host body function. Okay, revival uterine host, healing the wound. So you see, stage 1 is cut out the placenta. Second, destroy further the cancer. Third is to expel them. After you expel them, then you need to repair restore the host function body to close the wound. Basically, imagine a mom is already abortion or deliver the baby. Then the uterus need to heal. After you need to close and seal up the wound. So you eradicate the cancer stem cell. You can do embryonic cancer stem cell test, RGCC test, SOT, tumor vaccine, to prevent the relapses, okay? Okay, this is a consent form. Okay, the consent form is good for you to read through and understand your expectation. And anyone who wants to join this program, also you need to read through this. We can send this consent form to you. It is also in the Mandarin. When you read through, you just initial and sign. By reading through this consent form, you'll be able to understand the blocker even more. So let's go to the conclusion. Conclusion is that many people die of cancer because of complication, because of the harsh treatment, big wound, big surgery, back, relapses, very harsh treatment. The disease itself is not that bad, but the treatment is very bad. A lot of patients die because starvation, no nutrition, they are not able to eat or absorb, and then the cancer keep growing, space occupying lesion, the cancer grow until it occupy the whole body. Then conventional treatment is cut, chop, radiation, then chemo, and then they repeat this. After that, you palliative already, then or you can try some immunotherapy, try some NK cell. Actually, hyperthermia should be started. That means we should terbalik. We will have to convert it the other way around. We should start from the back. That means we should start at cellular therapy, NK cell therapy. We should think along NK cell management, basically. So hyperthermia can increase your NK cell, and it is an immunotherapy as well. So you can do NK cell therapy or using the placenta blocker to make your existing NK cell able to penetrate the cancer and kill them. Basically, do the cellular therapy first, then immunotherapy, then low dose radiation, then chemo usually no need. Surgery also, the tumor is very small already. You want to remove, then wait until the tumor very small, then you remove better than a big hole. So we just need to turn the sequence upside down. Okay, what are the common cancer complications? Don't die of pleural effusion, peritoneal effusion, ascites, liver very big, edema, brain cancer, malnutrition, infection. Because after chemo, your white blood cell so low, you get infection. People you, you die. That often due to overtreatment. Don't overtreat yourself. The harsh treatment, cardiac toxicity. Yeah, very true. A lot of breast cancer patients, they go through doxorubicin. Many doxorubicin is very toxic to the heart, and then the vaccine some more, mRNA injury, this, that, injection problems, respiratory failure. These are the complications. So totally possible to cure cancer without any knife. You can cure cancer without any chemical drugs, achieve complete response, relapse-free, not just tumor-free. You need to understand tumor-free sometimes is not cancer-free, Tumor-free means you go to hospital, you chop off your hand or arm or brain or whatever, you chop off already, then no more tumor. But that doesn't mean you are cancer-free. So you need to plan longer term. Strong immune memory to reject cancer means crosstalk. Lifelong cancer rejection immunity is very important. We want to help you to blacklist the cancer once and for all. So whole body tumor abortion. Yeah. Point number 7. Can you imagine how can you help your body to have a whole body tumor abortion? This is what we call the cancer eradication by the placenta blocker. Very wonderful. So RSCR means relapse-free complete remission. Not just a remission that is complete, but it is free of relapse. So you want an immunity that can reject the cancer, that long-lasting a lifetime, basically. So this is lifelong cancer rejection immunity. You can induce it. So you see this PET scan, whole body everywhere, 10 months later cure, no problem. You can induce it. How? You can teach your immune system to see a cancer, basically teach your T cell and B cell, go to the cancer. Once you take the placenta blocker, you continue to destroy the tumor. Destroy the tumor already, present the tumor to the antigen presenting cell, basically macrophage, B cell, T cell. Let the T cell eat and present to the CD48. The T cell will be the police that eat them and present to the B cell for memory, basically. So 5-step. Okay, how do you use the 5-step? Where's the cancer? Okay, you go and do a scan, find out where's the tumor, solid and tumor location. Okay, make them obvious, basically to heat them up, to do low dose radiation. Okay, chop off the placenta. Okay, then where's your immunity? Stimulate your immunity. Always eat well, do juicing, do injection, vitamin, mineral supplementation, stimulate your white blood cell. Don't keep rushing. You keep rushing to hospital, the immunity will only get down. All the treatment in hospital is reducing immunity, not increasing the immunity. We need to reduce the immunity. Number 4, let them fight. Once your immunity is out, antigen is there. Don't be afraid to let the cancer antigen to meet your antibody and let them fight. Expose them, teach your host to fight and then let them have fever. Crosstalk. Okay, number 5, crosstalk. What is crosstalk? Means T cell talk to B cell. After T cell catch the bad guy, they digest the bad guy and say, this is a bad guy, I want to blacklist. Then they will talk to the B cell, The B cell will be, we will blacklist this. How do you know the T cell talking to B cell? Is fever. Okay, every cancer patient is 60 fever away from their complete remission. So we want to create the blacklisting effect and memories. These are the last few slides talking about immune system. Initially, the cancer increasing. the T cell will come out and kill the enemy. When the enemy is down here, then the T cell will rest, but won't go to zero. The T cell will transfer the memory to B cell, which is about 10 weeks to 20 weeks. Basically, innate and adaptive, like initial and then later. This is a long-lasting one. So please, ladies and gentlemen, we need 10 to 20 weeks long-term planning. If you do not know how to plan, meet up with us so that we can discuss with you the planning and we can send details to you. So when you have a tumor, we need to destroy them, release the antigen, let the T cell be activated and fight in the lymph node. And then the whole body will have new immunity fighting the cancer antigen. And then this need to be trafficked to the new cancer area. So hypothermia would help you to achieve this new immunity going to new cancer area to kill the cancer. Okay, so this is what we call the famous five-fold therapy, basically. You know, cancer patients always have a very weak immune system, and then they have a corrupted immune system. Cancer patient always lack of fever. Cancer patient, their cancer is hiding away, and then being protected by the placenta. So if you chop off the placenta, then it is becoming obvious, okay? Imagine the cancer inside your body is being wrapped up like a socks, like an onion. Wow, I know the rubbish is inside, but the onion, okay? So you can peel them off bit by bit, When you take the placenta blocker, it is like peeling them off bit by bit, that your body finally is able to view the cancer as an obvious and stimulate an immunity, okay? Now, a lot of cancer patients, they have very bad bone marrow and thymus problem because of the overdose of the chemo, 10, 20, 30 rounds of it. Sometimes they keep on changing the drug without successful suppression of the cancer progression. So then you need to find ways of, okay, what is the five-fold therapy? Very simple. Stimulate your immunity. We can train you how to do some injection. And then you do some drip, the ICV drip, okay? This is ipilimumab, nivolumab, pembrolizumab. This is what we call the immune checkpoint blocker, once a week drip. You can also do some hypothermia and cold vaccine. This is fever training. Basically, we train your body to have fever 1 time or 2 times a week. Okay, give yourself 10 to 20 weeks, okay? Okay, take some time to train your immune system to have a cancer rejection, okay? And then when you abortion of the baby of the cancer, you need really systemic whole body detoxification learning, okay? Water enema, coffee enema, ozone water enema, ozone gas enema, all are very helpful for you, okay? Try to learn the modified Gerson therapy or Gerson therapy, very important. We can send information to you. Okay, now low dose radiation, very important. Some patients, after they take the placenta blocker, they have very big tumor burden. We need to further slowly destroy them by low dose radiation combination with cellular therapy, NK cell, CAR T cell, gamma delta T cell, no problem. I want to show you remission 1C. This is our local regional hypothermia. This is a hypothermia machine that can heat up any tumor that lighted up, the hotspot lighted up in your PET scan. Basically, it has a plate. You put a plate at the back of your, let's say for example, the hardest to treat cancer is pancreatic cancer. Now it has become the easiest because pancreas, at the back, you can put a plate of this plate here, put a plate at the back. In the front, there's no bone. There's no bone, then you can, put the plate, this probe on top of the tummy area. Put some, cream and then apply, and then you stay in this bed for 2 to 3 hours, heat up the tumor inside out like a microwave, basically. So hypothermia is very wonderful. Deeply seated hypothermia inhibit the repair of the cancer, causes cell death to the cancer, and then express the cancer into heat shock protein and train the immune system to kill cancer. And hypothermia can cause the cell death. Hypothermia can increase the blood flow. Hypothermia can also activate T cells. Hypothermia improve perfusion. Hypothermia will help the T cell to attach and kill the cancer. Hypothermia directly kill the cancer cell and induce them into cell death, So hypothermia causes cell death, inhibit the DNA repair, heat shock protein. Heat shock protein is a very famous immune stimulation. Hypothermia, if you do like 12-hour sessions later, your NK cell will increase 500 times, 50 to 500 times is wonderful. So it will improve lymphocyte trafficking into the new cells, new cancer area, increase the blood flow, reduce the acidity, increase the oxygen, improve the perfusion, wonderful, huh? And then once a week, we do whole body hypothermia by hacker. This is a hacker machine online. You check hacker hypothermia. This is once a week, we help you to do it. So you can do this together with the drip, okay? Now don't forget, these are the 7 methods that is going to help you, okay? After you take the placenta blocker, don't forget to do detox, restore your microbiome. For example, the FMT, full microbiome transplant, we can help you to do that. And then full spectrum nutrition, please. You have to take nutrition. Why? Because cancer patient very weak. You know, imagine you're pregnant with 10, 20 babies. How can you say you're not taking nutrition, right? Your body is very weak, and then they have been there for a few years, you know, the tumor. They plan to stay there. You remember, I told you, cancer is like a pregnancy, 10 to 20 baby one shot, and they plan to stay there for 10 years, you know. So your nutrition is going to be absolutely helpful. But you chop off the placenta first. Okay, oxygenation, very important. You can do oxidative therapy, ozone oxygen therapy, hyperbaric oxygen therapy. Okay, immunomodulation, what is this? You know, mistletoe therapy, immune cocktail injection, thymosin alpha-1 immune stimulation, GM-CSF, GCMF, all these are wonderful, no? These are some of the immune stimulant, you know. Even immune stimulant you can take orally, sublingually, no problem. Okay, focus on non-toxic cancer therapy such as vitamin C, IV drip of curcumin, IV drip of artesunate, oral tablet of ivermectin, fenbendazole, you know, artesunate, hydroxychloroquine. These are all the tablets lately, you know, Dr. William Marquis, you know, Dr. McCullough. So many, after the pandemic, so many tablet options available for those chemo-resistant turbo cancer, you know. So I think this is a wonderful news. Don't forget spiritual and emotional healing, very important. Okay, now here's the last slide talking about all the cancers is always sensitive. No cancer that is not sensitive. Every cancer are sensitive to vitamin C drip, artesunate, HCQ, ivermectin, fenbendazole, B17, DCA, vitamin B15, high dose selenium, imicotel, curcumin, fever. Look at that. No cancer is resistant to fever. Every cancer is very sensitive to fever. Active fever means then the remission one see I heat you up using machine. Okay. Passive fever means no, passive is I heat you up lah. Passive I use a machine to help you lah. Active means COVID vaccine. I inject a little bit of COVID vaccine for you. You will have a shivering for a few minutes, 5, 15, 20 minutes. Then you have a fever in our ward here, in our center here for 2 to 3 hours basically. Once a week training basically. So hypothermia, local, regional, systemic, very powerful anti-cancer treatment. This is modified Gerson means if you're a patient, focus on detox and then focus on nutrition, 70% self-care. The rest of the treatment will go through the sequences with you, okay? I can send this information to you. If you want this information, please raise your hand and then we'll be able to help you. So in conclusion, abscopal effect is inducible. Our immune system, we must conserve, reserve, and preserve. Protect your immune system. Don't destroy your immune system. Okay, stimulate and revive and release and grow your immune system and release them to work. Anti-corruption, very important. PD-1, PD-L1, PTL, CTLA4. These are the ICB drip once a week. Fever thermogenic, very important. You try to count your fever, okay? Don't suppress your fever. You know, fever is very beneficial for cancer recovery, okay? Once a week fever training. Low dose radiation therapy, wonderful. Okay, we can do intratumoral injection. Okay, we want to identify the tumor antigen, use it to train your body, okay? If you chop all the cancer and throw off, all your antigen is gone. How would you use it to train your body? You see, we need some cancer material to train your body, okay? The best way is while the cancer is growing in your body, we do the hypothermia, okay? Now look, number 5 is rebuild your bone marrow. Try to take a lot of nutrient supplementation to replenish your NK cell and DC, okay? So we need to hit the iron until it's hot, not to say hit the iron when it's hot. So why are we doing this? Because we are God's workmanship. We are created in Christ Jesus to do good works. So God has prepared a lot of good works for us to do. I hope we can continue this good work so that you can actually have the good news, so that you can do good for God and His design people. Okay. So every year we go to conferences to chase after the cure for cancers. And then this year, 2025, we go to Seoul every year talking about hypothermia medicine. I hope to see you there also. If you're a doctor, you can follow us in June 2025, okay? If you're a health practitioner, you want to learn about all these protocols, let us know. We vow to train 5,000 doctors in Southeast Asia to really learn about integrative oncology. And also, if you're part of the medical team or medical expert, or you're a health enthusiast, you want to learn how to use non-toxic approach and also integrative approach to cure cancer cases in Southeast Asia, you're welcome to connect with us. We won't stop until we train 5,000 doctors. Okay, so if you're a medical expert, obviously. You have any question, you can send question to us, and this is our contact. You can connect to us with Line or the WhatsApp, and we are in Taiwan, USJ, and we have a team of assistants. They are able to take your question, and also most important, if you have any medical report, you can send it to us through the nutri.wdc@gmail.com. This is our email. And then for us, if you want to know our location and know more about what we do, you can go to this beacon.ai, the bottom here, beacon.ai. Well, again, okay. If you have a camera, iPhone or whatever phone, you want to take a snapshot, you can snapshot this photo here so that you can get connected with us. Okay. Okay, get connected with us. Do we have some question here? Okay, if anyone have question, you can ask. Yes, I have a question here. I received the first question is about how expensive is this medicine? How much is it? Well, the study that we talk about is actually mifepristone. This is a first line, first generation treatment protocol, and this tablet is actually controversial and also very difficult to get. But then this first generation placenta blocker already have 34 derivatives. Okay, the 17004, the 17 type derivative is the most active and important. And this compound is available, compounding pharmacy available. And then the 7th generation is called the compound 17004, the most penetrative power and also least side effects, basically. So the 7th generation is for stage 4. Okay. And then it's about 950 ringgit for the treatment. And then this is a 3rd generation treatment protocol. Okay, the 3rd generation, even the 3rd generation works very well also. If you cannot afford, you start with 3rd generation, then later step up to 5th generation, and 7th generation is okay. 1 month, that's okay. Certain people, they are very advanced, very sick. So we teach them how to start from 7th generation first, maybe for a few weeks, 10 tablet, 20, 30 tablet, maybe then step down later when you get well, and then you step down to 3rd generation, as long as you continue every day 1 tablet, okay? So second question is, can stage 1 and stage 2 cancer patient take this tablet? Yes, definitely. This is a placenta blocker for any cancers, basically. Even though you are concerned that you will get cancers, you can take this also. Short term, no problem. But usually cancer is now so rampantly high. I suggest you do investigation, you do screening, you do cancer marker, you check, health screening important, PET scan, order a PET scan, all right, if you suspect. Or you take a liquid biopsy called the RGCC oncotrace, you can take the blood test, send for full tumor marker, 27 type of tumor markers. You can also check your lymphocyte subset, take your blood to send for lymphocyte checking. You can also do chest X-ray, PA lateral, 2 views. You can do full body ultrasound, check your organs, whether there's any tumor, mammogram or self-examination of the breast. These are all useful tests to find out whether you have any stage 1 or stage 2 or even stage 0 cancers, okay? Early detection, very important. But then avoid all kinds of mRNA injection right now, because a lot of mRNA injection induce turbo cancer, carefully. Okay, so can stage 1 and stage 2 cancer patient take this? Yes, no problem. Once a day tablet. Okay, question number 3. How long do I need to take and how soon I will see the result for the tumor shrinking? How long do I need to take it? Okay, from the studies, our advice is 90 days. Basically, you try to take 90 days to 180 days. I mean, if you take this tablet alone and do nothing else, I think this is very dumb lah. Don't do that lah. Please don't do that. I hope you are not trying to take this tablet for 16 years kind of thing. I hope you take maybe 16 weeks or 16 months, you cure already, and then you get rid of it. I hope you are understanding how to integrate lah. Don't just take this alone. Although this tablet alone is very good palliative and also symptomatic relief, and also it will work very nicely as a standalone treatment. But that's not the whole point of me talking to you here. It's because I want you to stay on top of things and monitor and understand how to integrate and get rid of the tumor. Remember, I talked about the 5 stage, right? You cut the placenta, you continue to destroy and give pressure to the tumor to shrink them. Then you expel them, detox is very important. Then you want to recover your body deficiency. And you want to also and you want to also get rid or seal off and cut off the tumor. Okay, speakers gallery. Yeah. All right. Is this suitable for all type of cancer? Yes. Is this tablet suitable for all type of cancer? Is this suitable for all type of cancer? Yes, it is suitable for all type of cancers. Is there any side effects? Okay, side effects, as I said, if you're a man, progesterone has very little tumor effects. So 有 questions is it？ 这个是什么？哦、what is the standard side effect？ 呀啦，okay. What is the standard side effect? The standard side effect is imagine you are a mother delivered the baby. Okay, you feel relief. Okay, sometimes you feel weak because baby come out. Sometimes you get infection because the baby stays. You know, let's say you have a lot of high tumor burden, you need to continue to destroy the tumor and excrete them out. Okay, that's important. So detoxification is very important. You please come in and learn about the water enema, coffee enema, ozone enema, and then ozone gas enema, you know, and then the sauna sweat, you know, hypothermia, okay, and then chelators, and then oral dental health. Okay, we have a sequence, we have a healing sequence, you know, our staff is able to send it to you. I think in this webinar, we are able to send the information about our webinar and also the next few webinars, and as well as the healing sequence. Also, we are able to let you have the COVID vaccine link, okay, to understand the fever. Okay, if you are interested to know more, can you reply? Can you reply your contact and you know, contact our staff during this webinar? We'll be able to reach out to you, tell us your handphone, or you know, connect to us. Okay, those are there. The side effect that sometimes we see is usually premenopausal women. If you're postmenopausal, no problem. Premenopausal women sometimes got skin rashes. Sometimes skin rashes. The information I post to you also, you please read through. Okay, this is very open information. Okay, and can this mifepristone take with a targeted drug? Yes. Okay. For your information, mifepristone is the very old first generation medicine. It's not available, but the derivative is there are 34 derivatives. Okay, 34 derivative. The seventh generation is the compound 1704004. Compounds 17004 is the seventh generation. And then there's this fifth generation and the third generation. Okay, so these are the compound available. And why is the 3, 5, and 7 generation compound better? Is because I mean, medical legally this is available, not so controversial. Side effect also very little, and then better side effect profile and also better penetrative power. You can penetrate to the brain, to the bone, to the lung, and then to the cold area, lymphoma, leukemia, brain, you know, melanoma, small cell lung cancer, triple negative breast cancer, you know, hopeless case. Okay, targeted drug, you know, targeted drug only work for a while, you know, because every cancer, there is every 1 cm cancer, there is more than 30,000 type of receptors targets, and there's more than 30 billion cells. So if you biopsy, you know, you test for the receptor, 30,000 type of receptors. The targeted, maybe you tested some target, then you call it a target. But then the target is target lah. Every cancer is wrapped by the placenta. So you chop the placenta, very smart strategy, okay? So this is placenta blocker strategy, okay? We'll be doing another webinar in Mandarin, okay? If any one of you want Mandarin information, we do another webinar about the Mandarin information, okay? I gotta go. Okay, I hope you can connect to us. If you have any report, just send to us. Okay, our email is nutri.wadc@gmail.com. Okay, my phone number is 012-646-8088. Okay, 012-646-8088. If you gain access to my team, you'll be able to gain access to me. If you want, we can form a family group with you so that you can look in your family member to discuss the cases, you know, to go through the lifestyle changes, you know, counseling, okay, answer to your questions. A nasty report, we can review it for you, okay? If there is no more questions, we will end this meeting. Okay. Yes, thank you, May. You have wrote there about our email. Okay, our contact numbers. Wonderful. Okay. More video is available to you if you need. Okay, why don't we arrange a time to meet up and discuss, you know, how to plan this schedule for you to get started this tablet, okay? If you're outstations, we can send this tablet to you easily. We have sent tablet to Ireland also. Ireland, actually, you need both. Ireland, you need the doctor there to prescribe and then here prescribe. We have people from Chiang Rai fly in to take this tablet away, you know, Northern Thailand, and then Indonesia, Singapore, Australia, okay. Every country we have someone with this tablet, life-saving tablet are available. Philippines, okay. Vietnam, okay. this East Malaysia, Sabah, Sarawak, okay, Northern Penang, okay, Johor, okay, Thailand, yes. So if you are from overseas, no problem, we can send it to you. And pretty soon we want to explore the options of this tablet available, make it available into this Middle East area through some of our colleagues, you know, make it available to Dubai, okay, to bless the world, and then UK, okay, UK quite a lot of patients, okay. You're welcome to explore these options, okay? So basically this is an improved version and it's a generation 3, generation 5, generation 7, okay? If you have cancer everywhere, just get started, swallow every day, you start to see improvement. And please combine it. The whole idea is to combine this treatment together with many other things together, okay? It doesn't contradict, but it helps, okay? Okay, thank you very much. See you later. Bye-bye.